I intend to go slowly because I've been very careful to put together the information that is most relevant for our work and which has a lot of thought behind it. We are lucky that we can all go over these lectures again in our own time. They'll be shown either on the Institute website or on YouTube. And I believe that will be invaluable to really take in what it is I hope to present to you. It's the collection of over a couple of years of articles and thinking that have come my way, and I really have put a lot of time and effort into what I'm going to present. So please do think about going over it again in your own time to really take it in and realize its significance clinically. This piece of research came out just a few years ago, and it was in 2017, in fact, and it truly did shake the medical profession at the time, because it caused the medical profession to seriously reevaluate the body's natural self-reparative mechanisms. It was clear from the figures, from the findings of this piece of research and a few others that followed, that exercise protected from cancer in a number of cancerous conditions. This is a well-illustrated synopsis of the phenomena that we've been looking at. Of course, labeling the symptoms as, on the top here, centrally mediated or central amplification, that is as a consequence of there being a central nervous system amplification of pain, gives away the fact that these syndromes are increasingly seen as pathologically sustained upregulation of the central nervous system. They're using fibromyalgia here as an example. Okay, we have the pain stimuli passing along a nociceptor afferent fiber, entering the dorsal horn cells in the spinal cord, crosses over, as you know, the spinal thalamic tract, crosses over and reaches the thalamus chiefly as the perceived area for pain. In the normal case, there would be descending modulation, inhibitory modulation of the pain that's being experienced. In the case of fibromyalgia, a minimal stimuli will induce pain because of central amplification in the dorsal cord or in the brain. Very slowly, very carefully. Let's just look at this round picture here because it basically sums up the fact that nociceptive pain and nociplastic pain and neuropathic pain can all be mixed up together. Let's try to look at it a little more closely. Let's start with the square on the left. Look at nociceptive pain. We've already learned that it's due to activation of nociceptors. It could be because of inflammation or mechanical irritants or injury. And we all know examples. It's our common daily bread and butter. Osteoarthritis, ankle sprains, rheumatoid arthritis does come into that to some degree as well. Let's jump to the third square, the neuropathic pain. We've already learnt, just briefly, that it's due to a lesion or disease within the somatosensory system itself. An example that you're all familiar with is diabetic neuropathy. Carpal tunnel syndrome would be considered neuropathic pain. Now, because the dorsal root ganglion is sited in the vertebral foramen, and we'll look at that in a moment, it is particularly vulnerable to mechanical stress and thus irritation, particularly where there's significant narrowing of the vertebral foramen due to disc herniation, ligamentum flavum thickening, facet hypertrophy, and loss of disc space. This barrier is one of a group of highly selective, semi-permeable barriers that control the exchange between the blood and the nerve tissue. It does this by limiting passive diffusion of blood-borne solutes while actively transporting essential molecules. Things start to go wrong as the very special tight junctions in the blood vessel wall start to break down. But we have an osteopathic obligation in most inflammatory cases to try, at least to try, to ease the patient's distress by at least trying to help clear the inflammatory soup and reduce the myofascial strains inducing aberrant neural signaling. This couldn't be more contemporaneous in regard to COVID-19 and the attempt to prevent it reaching the cytokine storm stage that I looked at in the very first lecture.